Well, from medicine to those that usually prescribe such things, the Gem State is last in the country when it comes to the number of doctors per capita practicing within its borders. It's been that way for years, for a handful of reasons. And it's even tougher in remote parts of the state. But conversely, Idaho is one of the better states when it comes to keeping future doctors who do their residencies here. So it seems one might be a cure for the other. More residencies should equal more doctors in Idaho. Well, St. Alphonsus is launching a new program next week to take a shot at that. Joe Paris takes us to Nampa for a look at the family medicine residency program, hoping to boost the supply of doctors in Idaho.
Idaho, it has been 50th out of 50 states in per capita physician supply for, I think, the last 3 to 4 years running. And family medicine physicians can take care of anyone in any setting. And so this is a really important part of helping to move us up from last place.
Dr. Lisa Nelson is medical director of graduate medical education for St. Alphonsus Medical System. She's part of a team working to bring more doctors to Idaho.
We are very excited about this. It's been years of work.
St. Alphonsus and Mountain State Institute for Graduate Medical Education and Research, they're going to soon open Idaho's newest family medicine residency program.
Doctors who've just graduated from medical school are starting training in a specialty of their choice. In this case, it's family medicine, so they will really learn to take care of people from birth through death.
The hope for residents as they become doctors through the 3-year program, that they remain residents of Idaho.
We actually track this here in Idaho, and we're actually, with our current residency programs, we're number 3 in the nation with keeping our residency graduates here in the state, so we're really excited to be a part of that.
I think there's a tremendous amount of excitement to have these residents come because they are filling a need that's just going to be growing.
Dr. Stuart Black is the Associate Program Director for the new residency.
They're going to be learning both how to take care of patients in a hospital setting when they're sick or helping to deliver babies, as well as in the outpatient setting, primary care and preventive care.
The simplified goal for Black and others centers on the people of Idaho.
Being able to be on the front line of primary care is really important. You can prevent a lot of disease if you can catch things early or get people to make lifestyle changes that improve their health. And many studies have showed that if you have an increase in primary care doctors, you have an improvement in health overall in the community.
The 9th family medicine residency program in the state. We only have 16 residency programs total. Some large university settings might have 20 programs just in that one setting. So just being able to expand the number of trainees and knowing that we're so good at keeping our graduates here, hopefully these doctors that are young doctors that are training here will someday be your family physician.
We definitely are going to strive to be the best residency program we can, and we feel that we have the facilities and the faculty to do that. And students want to go where there are the best teachers and the best facilities, and I think we're going to be able to provide that.
I met many of them during their interviews. They're just good people who are excited to come here and learn and take care of the community.
So the program begins July 1st, and that first cohort includes strong Idaho connections. Almost all the students are native Idahoans or did their schooling here in the area at places like ICOM. And Brian, with the residents, they're also going to have a residence clinic. That'll get up and running over the next several, I guess, weeks and months. But it is a really big step for places like St. Alphonsus to create these programs to generate doctors. Again, it's no exaggeration to say that Idaho at the bottom of the list of per capita doctors.
That's a fact, not an exaggeration. But the point is, this discussion was brought up during this, well, the talk about expanding the medical school with WWAMI and stuff like that. The number of residency programs in the state, we couldn't accommodate for the increase that they wanted when it comes to seats in these schools. Does this do anything to fix that?
They want to be a destination for Idaho, I guess, natives or people that are from the area, no matter where they do their medical schooling, knowing that there will be a residency program here in Nampa at a state-of-the-art facility, they're hoping is really going to be an attract to doctors to come home. Like Governor Little said, we want our kids to come back home, but also for some of the top talent in the region so that we have valuable doctors in areas like Nampa, but also places across Idaho.
All right, we'll see if it works. Thanks, Joe.